Hello there. Due to, due to some technical difficulties, we haven't been able to hear the introduction from the Thyroid Federation International. So I'm sorry about that. In terms of to welcome you all, I'm sorry we're a minute late. Some last minute digital gremlins. This session's all going to be about the role of iodine for a healthy thyroid, and also in pregnancy. And it's a combination effort, particularly by Thyroid Federation International and also the British Thyroid Foundation. And my name is Pete Taylor. I'm giving one of the talks here. Then there'll be a bit of a panel discussion and also a bit of a talk from Julia Priestley, I think, from the British Thyroid Foundation. And in terms of, for those who don't know me, I'm a consultant endocrinologist based at the Heath Hospital in Cardiff, but I'm also an epidemiologist as well, and I work with Cardiff University. And I have a role with UK Iodine, looking at trying to improve the status of iodine in the UK. So I'm really excited to be given the chance to have a chat with you all and just go through a few things that I think are particularly important regarding iodine and maintaining both a healthy thyroid throughout life, but also in pregnancy. And would really welcome, because what matters to me in particular is getting the general public's iodine's knowledge higher, but also getting greater access to what's a good source of iodine for people. So sort of your experiences in the discussions and also your thoughts I'll be particularly grateful for as well. So without further ado, I will move on. So iodine. So a lot of you may know this already, but I thought it's just good to have a quick recap. So iodine is essential for thyroid hormone production. It's the iodine components in both free triiodothyronine and free thyroxine, which is what iodine is essential in its creation. You can have too much of a good thing. It's very important not to have too much or too little iodine, and we'll go into the consequences of that. And you need adequate iodine for thyroid hormones in pregnancy, but also for the fetal thyroid as well. And actually, an adequate iodine intake is essential for fetal brain development. And because iodine stores can only be for a certain period of time, you need to have ongoing good quality amounts of iodine in the diet. And the problem with iodine, although it's abundant in the world, it's not evenly distributed. So quite a lot of people are exposed to areas where there is insufficient iodine intake. And the problem of that is that it results in the thyroid not working properly. And if it's a pregnant woman or a woman of childbearing age, if there's so poor iodine levels, then you can have impaired offspring development, both in terms of pregnancy outcomes, but also in IQ. The WHO has made iodine sufficiency one of its major ways of improving global health, and there's been a real significant amount of work done, probably largely since almost 100 years. But in the last 40 years or so, people have really moved on. So while that's all very good, despite the fact there's been some dramatic improvements, particularly in Africa, that's been one of the real success stories. In Europe, we're still at risk of iodine deficiency. And we're actually at risk of iodine deficiency because actually we've slightly changed the way we do things. Our diet is changing. Our meat and dairy intake is going down. And one of the problems, as you can see here, is that cow's milk, particularly for the UK, is actually got a really good amount of iodine. And as we're having less of that, then that is increasing our risk of iodine deficiency. And actually, looking at the trajectory for the UK's iodine status over the last few years, it is starting to drift down. So despite the fact people are aware of iodine, they're still not able to get a sufficient diet. And one of the reasons is if you're having less dairy, is that some of the other sources are actually quite expensive. So although the UK is a coastal nation, we actually have fairly poor levels of fish intake. And actually some of the ones which contain the best amounts of iodine are among the more expensive fish. We've got other sources such as eggs, and typically in the UK, because we don't use iodized salt in our bread, the bread, although it does contain a little bit of iodine, it's not very much. So although we've had great successes at the global level, Europe in particular still has a little way to go. So this is a little review we did a couple of years ago in Nature Reviews Endocrinology, and what we wanted to show is that in pregnancy, this is how we divide the world. And what you can see is that if you can see how it looks for sufficient iodine, you can see that not many places have sufficient iodine. You've got Canada, you've also got Brazil, and you've got China, so quite populous countries. But actually not many countries have got, as far as we know, a sufficient iodine intake for pregnancy. For most of the countries shown in sort of blue, they are fine for the general population, but they are not so good in pregnancy because we move the goalposts in pregnancy. And I'll come on to why we do that later. So although we've done really well at getting rid of the horrors of severe iodine deficiency, we've still got a bit of fine tuning to do to make sure everyone in the world has enough iodine to have a good pregnancy outcome. And interestingly, this counterbalances, as you can see, these are countries which have mandatory iodization. And what you can see is that China, Canada, Brazil, the ones that have done really well with getting a good iodine status in pregnancy, they all have mandatory iodization. As you can see, most of Africa has mandatory iodization of salt. So that's been one of the reasons why they've been able to get relatively good levels in some countries for pregnancy. And generally speaking, for the general population, Africa's now at a good level. It's sort of Europe, particularly the UK, and to a lesser extent France, Russia and Spain, where we've been struggling to maintain iodine sufficiency. So why does it matter in pregnancy? Well, there's a few things that happen in pregnancy in terms of physiological changes that have a significant impact on both the thyroid axis, but also on iodine. So when women are pregnant, they will have the pregnancy hormone HCG, and that will actually increase your T3 and T4 levels. We think that's probably an adaptive mechanism. So your thyroid needs to be more active during pregnancy. It's getting an extra kick to help it going. What's been really interesting is also the other changes, though. We increase our thyroid binding globulins, so that actually puts a bit more pressure on the thyroid to maintain the current free levels, the active hormones that work. But bizarrely, in pregnancy, we don't really understand why it's the case, is you actually lose more iodine. So that's another reason in your urine. That's another reason why we need to keep good levels in pregnancy, keep women well topped up. For those of you who are also hypothyroid, one interesting thing is if you've got thyroid autoimmunity, particularly TPO antibodies, there is a bit of evidence that you don't get this benefit kick from the HCG. So you don't get that extra support to your thyroid, which is another reason why iodine is so important. The fetal thyroid, remember you're needing iodine for 2. That will also need iodine to make thyroid hormone. And that usually kicks in round about week 17 of pregnancy. But again, you do need to maintain iodine intake throughout pregnancy, not just the early stages which are critical for neurological development. So when we look at the goalposts generally, so this is looking at school-aged children and adults. So on the left-hand side, this is the median urinary iodine concentration. What we can see here is 100 to 199, as I've highlighted, is satisfactory iodine status. And this is usually met by most of the countries on the map that I showed earlier. However, in pregnancy, because it's moved from 100 to 150 to 249, that sort of increase means that actually a lot of countries fall short. So the UK, for instance, has been hovering around about the 100 mark, and it's just dropped below 100, we think, on the latest data that we've seen. But about a year ago, it was down at 102. So okay, just for the general population, but inadequate for pregnancy. And generally speaking, we think the non-pregnant population requires about 150 micrograms of iodine a day, but in pregnancy, this requirement rises to around about 250. It is possible to go above, and you can get an above required intake, so that's 250 to 499. We don't think that's particularly harmful, though we would recommend against it, but to actually have a really high level in pregnancy is pretty hard going. You have to be taking some unusual extracts usually, or have a very unusual diet. So it's usually quite hard to get excessive iodine status in pregnancy. That is obviously to be avoided. So thinking about things, iodized salt, and this is something that we will all be have access to in some countries. So in the last 30 years, there's been mandatory salt iodization in many countries, and actually now 120 countries in the world have that. The UK and Russia are notable countries which could do better. To my mind, we're advanced economies, but we actually have got quite a reasonable amount of iodine insufficiency, but we haven't taken that step. And as you can see, as I showed before, the real success stories has really been in South America, and also Africa, where salt iodization has been very effectively uptaken, as well as in Australia and New Zealand. And it's worth bearing in mind that Australia and New Zealand have got very similar levels of iodine status before they iodized salt than Western Europe. So what's the benefit of iodized salt? And this is what we need to be thinking about. Well, it's regularly added to meals during cooking. It's used as an ingredient in commercially ready meals, as well as staple vehicles of food such as bread. And what's quite helpful for salt, because there's often this campaign against salt because of its effect on heart disease and the like, is salt intake in a population is usually pretty stable over the year. And it's also usually present in major food groups that are taken by people of all socioeconomic status. And it's important that whatever vehicle is used is actually able to reach all disadvantaged groups, but in particular pregnant women. And that salt has been, a very effective tool for this. But actually, salt on its own is not the be all and the end all. And then more work needs to be done. And again, why people need to be better educated. So if you've been on iodized salt, this is long-term versus short-term. So this is a mild thyroid failure prevalence. As you can see, there's quite high numbers of mild thyroid failure. And what you've got there is people with long-term salt in black and people with short-term access to salt. What you can see is if you've not been taking iodized salt for a while, you've not built up the stores, you actually find that you are more likely to have mild thyroid failure, even though you're trying, if you've just started to have iodized salt. So although you can buy iodized salt in some European countries where we don't have mandatory salt iodization, it's a bit of a niche. So you have to be educated to think about getting it. But ideally, you should be having it for several months before pregnancy just to get your stores up. So if it's suddenly, and there's a lot of pregnancies in Europe are either not planned to a great extent, or there's the people who go, well, we're not actively trying, but if it happens, it will be a nice thing. They may not be thinking about these things. So one way around that is just to make sure everyone's got access to long-term iodization, and that can either be through salt or through a vehicle such as bread, where everyone is constantly getting exposed to iodine, just getting their levels up. So the key take-home message perhaps from this is that women with adequate iodine intake before pregnancy, and it's been there for several months, will usually be able to cope with this increased demand. If you're going into pregnancy a bit low, even if you are having some extra kicks such as iodized salt, it won't actually perhaps be quite enough to get all the benefits. Obviously better than nothing, but we want people to have as many of the benefits as possible. And actually, some studies have shown that even women on long-term salt iodization may fall short. And that's one of the problems is we've actually got quite a wide variety in how much iodine is in table salt. So for instance, table salt in Italy is iodized at 30 parts per million. And that's actually fairly typical of most European programs. Although actually it's much lower than the 100 parts per million that's used in the USA. And obviously, you need to have regular checks to make sure you're getting the right dose. So the Danish have been very successful in having their salt iodization program, but also then regularly checking people to make sure it's sufficient. Then that's really important because you can't just set a level and hope it's going to be okay. You've got to keep checking. But think about the UK perspective as well. In the UK, cow's milk is a very critical source of iodine. We are drinking very much less milk than we used to, and as a result, for many of us, we're falling too short of the target required in pregnancy. The one thing that has actually taken us by surprise is the change in milk alternative drinks, such as soy or almond, which, although they're very good for the planet, they're less good typically because they tend to have low iodine concentrations, so are not really suitable. So not all milks are created equal. So population groups, particularly such as vegans, which is becoming a more widely used dietary practice across the UK and across Europe and a lot of the developed world, it's not ideal for that side of things because they're not going to have as much iodine. Often the foods such as white fish that are particularly good for iodine are relatively expensive, and there's not typically great intake, certainly in the UK, from our diet studies of women of childbearing age. Lots of pregnancy supplements do contain iodine, probably not quite enough on some of them, but again, not all of them, only about under half will have a good amount of iodine available, and less than 5% of UK women are actually using iodized salt. So it's worth bearing in mind that although we've got various sources of diet and people know to take milk, not everyone perhaps knew, for example, that soy or almond milk doesn't really have any iodine in it at all. So again, it's just to make people aware it's not just having milk. You've got to have the more common garden, boring and old-fashioned milk in the majority of cases. And again, if you've got people taking iodine supplements and they've been thinking and preparing in advance, in some countries, there is still a bit of evidence to say that actually taking iodine supplements on their own doesn't quite get you over the line in pregnancy. You need to have that little bit more. So it's kind of supplements plus diet. Now, whether or not we can do it supplements plus a regular vehicle, such as bread or universal salt iodization, that's to be decided. But supplements, even if you're well educated and have got a reasonable diet, may not be enough for pregnancy. We may need to give a bit of a help by having extra vehicles fortified with salt. And this has caught my mind, so I've been criticising sort of what's going on in the UK a little bit. In America, which has generally been better, one thing that caught my eye was a study that showed 74.2% of adult multivitamins contain iodine, which is not bad at all, but only 57% of prenatal vitamins. So you actually need a bit more when you're pregnant. So it's somewhat disappointing that you don't have iodine. So again, it's not only making sure people are taking vitamins, you've got to be on the right vitamins as well. And that's why public knowledge is vital. One of the sad things is it's lacking. So in the UK, perhaps, to give an example, we all became very aware of folic acid in pregnancy. And there was a very good, for those of people with long memories of EastEnders in the early 90s, of a popular couple on EastEnders having a baby with spina bifida on the scan. And that really raised awareness of the importance of folic acid. The problem with iodine is it's less of a dramatic effect on an individual, generally speaking, and only mild to moderate, but at the population effect, it's huge. If you think about the effect of dropping people's IQ points by a couple of points, as a cumulative effect is absolutely massive. The effect of iodine insufficiency is not as severe as some of these other pregnancy deficiencies. And that's why I think there's been less real awareness in the public and less of a desire to really make that better, because there's not been these sort of catastrophic consequences that are seen with other dietary deficiencies. It's more of a general lowering of the population as a whole, but important because it's affecting the whole population, and moving the IQ point down ever so slightly will have a massive effect on quality of life overall for the country, but also on a sort of simple economics as well. And what about people with established thyroid disease? So remember, people who are on levothyroxine, they should hopefully know to increase their levothyroxine during pregnancy, and that solves a lot of the problems of iodine. But bearing in mind, the fetal thyroid still needs iodine to work, and you still need to get that development, right? So you're still going to need to remember to have an adequate source of iodine. One's always got to be careful a little bit with excessive iodine, particularly of new thyrotoxicosis, because that can exacerbate it, particularly if you've got a salty toxic nodule or multinodular goiter. But bearing in mind, you usually have to try quite hard to get a very excessive amount of iodine intake, and that's usually taking some of the slightly more unusual extracts that are done, particularly the ones containing certain types of green seaweed contain very high levels of iodine, so you've just got to be very careful of those. So in terms of my thinking about what we need to do now, I think the clear thing is for iodine sufficiency, particularly in pregnancy, we can almost get there with how it's going in the general population, is we need a multifactorial approach. So you need both supplements and either some other vehicles such as salt. Australia and New Zealand have done really great work getting iodine into bread, and I think that's probably something that Europe could do with copying as well. There needs to be much greater public awareness and education, so that's why these things are so valuable and so helpful. There actually needs to be better national and international guidance. There's some stuff on even the NHS website that I'm not sure myself, one of the members of UK Iodine, particularly agree with everything there, but also there needs to be better national and international guidance, because I think there's a lot of literature out there that's quite confusing. I think we really need to be aware of these new at-risk groups that I really hadn't been that concerned about through my own naivety before, but also because they were less common in the population. But veganism is getting much more common, and great awareness of lactose intolerance. So we need to actually think about promoting and identifying at-risk groups. Pre-pregnancy planning is essential, but again, with modern life, not always possible. And again, just to reiterate, I think the future potentially for the UK is to go down the fortification of bread route. But again, that's going to require government and public health support for that. So I think that's all for me from this talk, is just to give a bit of an update and get everyone's minds thinking rolling, and sort of hopefully stimulate a bit of healthy debate and some questions. And now I think if I can bring some of the other panel members on as well, and take it from there.
Yes, Peter, thank you very much. This was a very interesting talk. We have a couple of questions. Fatma Nur Korkmaz asks whether there are excess, wait a minute, whether there are excess iodine complications.
So yes, excess iodine complications can be a problem. So if you suddenly take a lot of iodine, and it's usually quite a lot, you can actually get a temporary stunning of the thyroid, we think, which will tend to cause a drop in the hormones. If you're taking long-term excess iodine, you increase your risk of nodular disease, you increase your risk of getting thyrotoxicosis, particularly in the elderly. And one of the concerns about iodization is that if you're like the UK, where you've been iodine deficient for a long time, you do tend to get a bit of a goiter, and then if you suddenly become iodine sufficient and then go towards the higher end and into excess, you increase your risk of actually getting toxic multinodular goiter, so hyperthyroidism in the elderly. And we do see actually a bit of an increase in thyroid autoimmunity in younger individuals as well when that happens. But those effects tend to be fairly mild. They don't tend to have dramatic effects. And compared to having iodine sufficiency in the population, I think the balance of risk-benefit would generally favour having an improvement in iodine status for countries like the UK and Russia.
Okay. Julia?
So I think
the next question is from Nicolina Rucolta. Should we recommend iodine supplementation to all pregnant women and to all women trying to conceive, including those with autoimmune thyroiditis?
So I think there needs to be a general recommendation that you will need to take either a pregnancy vitamin with a reasonable amount of iodine in it, and I think that's just fairly good practice. That's for everyone. So that's the general population, and also people at potential risk from thyroid disease. Certainly, there won't be any obvious harm from that.
Okay.
I can see, perhaps while Julia's trying to link in, I can see there's been a couple more. Somebody, Radu Eon Rotorus has said, do you think that iodization leads to more autoimmunity? That's a really good question. Some of the epidemiological data might suggest that, but I haven't got an obvious mechanism for that. And I to be honest, at the risk of sounding blasé, I don't particularly worry about having a potential slight increase in thyroid autoimmunity, because thyroid autoimmunity is so very common and the benefits of iodine are so significant. So we do see a potential rise in antibody titers, but it's not necessarily massively related to clinical disease. So I've got Barbara Demany, one of my favourite professors of all time. She's asked, is there a potential link between iodine, thyroid, and lactose insensitivity? I don't I don't know. My comment was more about lactose insensitivity, and then not being able to have access to the proper milk. So my own boy has got quite bad lactose intolerance, and as a result of that, he's on his special milks. And I've had a look; they contain very much less iodine than the milk we're all having. So I just slightly worry about making sure he has particularly good iodine intake. In terms of what about the age of pregnant women? There's a question from Liana Jeshi. Well, this is one of the problems because pregnancy is quite a wide age group. Certainly in my thyroid pregnancy clinic, I'm seeing a lot of women in the late 30s and early 40s because perhaps they've watched everything on Netflix with their partners. They're now attending my thyroid pregnancy clinic. I think it's just maintaining it throughout the general female population. So that's why I like the idea of having a vehicle such as bread or universal salt iodization. Julie, can you now access the questions? Did you want to do a few or?
She's still muted.
Peter, do you want to pick out a few more questions?
Yes, Catherine Petzold asks, what's your stance on enriching your diet with, for instance, seaweed for people who don't eat fish? As you said, vegans who don't have an animal-based iodine intake.
So really good question. Vegans is what worries me as a group. I slightly worry about some of these seaweed extracts and kelp. I think it's much better to have a more standardized amount of iodine extract. So either having a good iodine supplement because you picked a prenatal vitamin with a good level of iodine, or you've got access to universal iodized salt. I would even if I wasn't taking, say, cow's milk, I would be cautious about going down the seaweed route. It's not something I would recommend.
Okay. Another question is whether iodine supplements will be useful for hypothyroid patients.
So to an extent, iodine supplements are probably less of an issue in the very early part of pregnancy because you're already on your thyroid hormone and that's getting the extra kick if you've increased your thyroid hormone replacement. But remember, the fetal iodine does cross the placenta and the fetal thyroid does need iodine. So I would just ensure that you had a good level of iodine throughout pregnancy, even if you were on levothyroxine and were treated hypothyroidism. Although you're still getting your thyroid hormone, I think you still need to have an adequate supply for the fetal thyroid as well.
Mm-hmm. Is there any relationship between iodine supplementation and the reduced risk of recurrent pregnancy loss?
So that's a really, really great question. The answer is we probably don't have really good data for that. What we have found is that there doesn't seem to be a great evidence for iodine supplementation triggered during pregnancy. That doesn't seem to have any dramatic benefits that I'm aware of. But remember, a lot of the effects in sort of pregnancy loss is quite early in pregnancy, and by the time people realize they're pregnant, modify the diet, it's a bit too late for iodine supplements. We don't have the data to suggest that iodine supplements sort of well in advance will reduce the risk of pregnancy outcome, but certainly we know that if you've got slightly off thyroid function going into pregnancy, you're more likely to have pregnancy loss. So indirectly, I think that there will be a potential benefit, but I don't have any clear evidence for that.
Okay, the session is closing now. All the questions that are asked in the Q&A will be replied to by Dr. Peter Taylor and can be read afterwards. Over to Julia for her presentation. Does it work, Julia?
If you're able to hear me, can you hear me now?
Yes, I hear you.
Okay, I'm not sure where my presentation is. There we are. Thank you. Thank you very much, Pete, for such a thorough overview of the current position about iodine and why it's so essential for pregnancy and the thyroid. And thank you for everybody who joined us this morning. 352 live viewers, which is wonderful for a Sunday morning. And to so many of you who asked questions, I'm sorry that I wasn't able to join in with the questions, but I'm really glad that Peter was there to pick them up. One of the key take-homes for me is the importance of public awareness and education about this. And this is something that the TFI and the BTF in the UK were set up to do. The BTF was founded 30 years ago, and for the last 8 years, we've supported an iodine project with the aim of improving understanding about the role of dietary iodine amongst thyroid patients and the wider public. As Dr. Taylor pointed out, the UK is one of the countries, unfortunately, that could do better. But addressing this problem and improving iodine deficiency in the key groups is not straightforward. It's now possible in the UK at least to buy iodized salt in some supermarkets, but it's significantly more expensive than ordinary table salt. And so getting a message to people that it may benefit them to use it, particularly the groups who would probably benefit it from it the most, it really is going to be a challenge. We know from our members and supporters that we hear from every day that there's huge confusion about dietary iodine, who needs it, when it's needed, how much is needed, and what about patients with thyroid disorders. And at the moment, there's a really confused message for everybody, and increasingly from the groups of people who don't eat dairy and fish. I've seen some work done with the Vegan Society in the last couple of weeks on social media, and that seemed to be a really effective way. And hopefully, by working more closely with these groups, a clearer message will come out for the public. Peter's on the committee of the UK Iodine Group, which brings together experts in thyroid, nutrition and public health with the purpose of ensuring that iodine deficiency is eradicated. And here at the BTF, we're really looking forward to working with this group, with Pete and his colleagues to help them achieve this. And finally, I'd just like to say a big thank you for all of you for joining us on a Sunday morning. Firstly, to Dr. Taylor, who's been our clinical expert, to the audience for listening and for your questions, to the TFI for hosting this Patient Voices session with us, and of course to the e-ECE for giving us this opportunity. During the rest of the week, please do make time to come and visit TFI and the BTF booths. We've got lots of resources for all thyroid patients and information that's useful for medical professionals as well as patients. Thank you very much. Goodbye, and I hope you enjoy the rest of your conference.
Thank you.
Thank you very much, all.